So we get this question very often about men and testosterone therapy, especially after they've had a cardiovascular event. So I've seen several people over the years that clearly had a heart attack or stroke after they were started on testosterone. So we got to make sure we're doing this appropriately. It has to be monitored closely, monitoring hemoglobin levels, monitoring for symptoms. So what this recent study found in the New England Journal of Medicine, where they took men with average testosterone around 200, age 63, known cardiovascular disease or cardiovascular disease risk factors. So these were pretty unhealthy men. So they're on testosterone gel or placebo. They follow them for 2 years. The good news is there was no significant cardiovascular event rates overall, testosterone versus placebo. There were some signals that I think are concerning: increased atrial fibrillation, increased pulmonary embolism, but overall the heart attack risk or stroke risk was not increased. So what I want to say is, if you're a male who is doing eat well, live well, think well, test, don't guess, evidence-based supplements, advanced biohacking strategies, and your testosterone is still low and you're having symptoms, then you can go on testosterone therapy. Testosterone therapy should be the last approach, not the first approach, and it should be done in the healthiest version of you. And if you're having symptoms, if you're not having symptoms, fatigue, low energy, erectile dysfunction, low libido, loss of muscle mass, if you're not having those symptoms and you're pretty happy in life, then there's no reason to go on testosterone therapy. Just to raise a number, it doesn't decrease cardiovascular events. So if you can avoid it, I would avoid it. If you need it, you're good to go. You're safe to take it.